Welcome back. Chapter number 17, older adults. So in the previous chapter, in chapter number 16, in exercise in Utes, we were trying to think back to as we were younger. Now we're going to try to look into the future, turn our flux capacitors on, go into the future and see what's going to be like as we get older. Now, the differences between younger individuals and older individuals is fairly significant. As we get older, and we're talking about in our 50s, 60s, 70s, 80s, and even 90s, we're going to start to break down. Our body's just the way it is. It's just going to, they're just going to break down. It doesn't matter what we do. Mother Time is going to, or Father Time, it's Mother Nature and Father Time. Whoever it is going to be taking control of our bodies, and we're going to start to break down. Now, we can negate and slow down some of that regression that occurs in the muscle mass loss as we get older. But once we hit 25 or 30, it's going to start to decrease. The VO2 max is going to start to decrease. Muscle mass is likely to start to decrease. Now, again, you can still gain muscle mass when you get older if you are deconditioned and all that stuff, but and still gain VO2 max and still gain cardiorespiratory fitness levels and everything like that. But it's still going to be maybe a little bit tougher. You're not going to be the peak that you can get to is going to be much, much less. And that's really what we're talking about here. So, and we'll discuss some of those things in the chapter. So chapter number 17, I hope you enjoy the chapter, and I'll come back to you afterward. Chapter number 17, exercise in older adults. One thing to keep in mind with older individuals is that in the United States, we're going to have a lot here within the coming years. So the number of people in the millions that are 65 and older from 1900 to 2060. And obviously anything from 2020 to 2060 is more of a projection. So right now we are at about 56 million individuals, 65 and older. That's going to increase closer to 80 million individuals once we get to 2040. And then in about 40 years, about 92 million individuals are going to be 65 years or older. And as the population ages, more issues tend to come about with health. Because as we get older, our bodies start to break down and we start to have issues, medical issues. And that is related to lifestyle choices, diet, physical activity, and that can result in taxing the healthcare system. Now, looking at age classification and characteristics of the population that we're talking about here. So middle age is 40 to 65 years of age, 10% to 30% loss of biological functions within this period of time. There's going to be some things that start to decrease as we get into this age group. Now, older age, the young old age group. So they're not quite old, but they're getting there. So they're 65 years of age to 75 years of age. There's a further loss of function in this age group. In the very old age, it's 75 to 85 years of age. There is a substantial impairment in the function, but it can still lead to an independent life. It's not like their life is completely over at that point, most often. Now, the older age group, the oldest age group, over 85 years of age, this could be the age group in which institutional or nursing care is typically needed, depending upon their conditions. So as we've seen in the first graph, the number of individuals who are 65 years of age or older is increasing. There's a wide continuum of functionality amongst this age group. There's a bunch of different diseases, disease processes, and also limitations that are not uniformly distributed amongst that entire age population. So individuality in exercise programming is actually key here. There's going to be some 65, 70-year-olds that can perform certain activities in which even a 45 or 50-year-old cannot. So focus on prevention and reducing the progression of a chronic disease, such as obesity, heart disease, type 2 diabetes. Now, physical activity limitations do increase with age. It's somewhat obvious, but it needs to be stated. Approximately 36% of older adults actually report a severe disability, sometimes related to joints and osteoarthritis. Most older adults actually have more than one chronic condition that is going to probably affect their movement in some way. Hypertension is up there, 72%, which can potentially lead to heart disease, lead to some blockages in some of the arteries, could lead to claudication or pain in the lower body, in the periphery, arthritis being a big one, heart disease, cancer, and then diabetes. Looking at the effects of aging on cardiorespiratory fitness, VO2 max tends to decline approximately 1% after the age of 20 in men and women. Now, this is a little bit lower of an age than what is seen in a lot of different sources. Most of the time, it's 25 to 30 years of age is when that decline starts to happen. However, it can happen as low as 20 years of age. And a lot of that is starting to come about because of the heart rate and the max heart rate. If we look at the max heart rate, there is a decrease in 1 beat per minute each year. Therefore, each year we decrease in max heart rate of 1, we're going to start to decrease in the maximum ability to get oxygen to the muscles and the working tissues, thus decreasing VO2 max. Now, when we look at the specifics of that decline, women appear to experience 1% decline independent of their activity status. So it doesn't matter how active they are, they're still going to decline in the VO2 max, approximately 1%, versus 0.5% per year in men that are still maintaining vigorous activity. And some of that is going to be related to the muscle mass that they have initially anyway and are able to keep. Now, that muscle mass is still going to decrease over time, but it's still going to help them maintain some of that VO2 max over time compared to females. Now, also, this can be a function of inactivity, weight gain, and aging. As we get older, our activity levels decrease. Therefore, our weight gain tends to go up. And also, our eating habits tend to not change all that much, or at least are slow to change. And in the addition of the inactivity, the weight gain tends to increase. The effects on aging and cardiorespiratory fitness. VO2 max values of trained older subjects are actually similar to untrained subjects several decades younger. So if you look at that, that's kind of an interesting point. Somebody who is older, who is training, has similar VO2 max values as somebody who is several decades younger. That shows the decrease in the VO2 max, the potential VO2 max as we age. So even somebody who is out of shape in their 20s can have a VO2 max of somebody who has trained all their life and are an older adult. That's astounding. That shows how much of a decrease is experienced as we age. Now, in some endurance events, other factors than VO2 may actually affect the performance in these individuals. The economy of movement. As we age, our efficiency of movement isn't as good as it was when we were younger. Our lactate threshold starts to decrease. And also, there could be some joint trauma, and osteoarthritis might start to cause some limitations in the ability to perform. Training for endurance in older adults. So the VO2 max increases about 10 to 30% in those who were previously sedentary. So even though they have decreased their VO2 max potential as they got older, if they have not been active, they can still increase their VO2 max. Now, it might not get to the level of somebody who is 20 or 25 years of age, but it's going to get higher than what they are at the moment. Looking into the physiology behind this, older men still increase VO2 max with increases in both the cardiac output and the oxygen extraction, the two parts of the Fick equation, Q times AVO2 difference. But conversely, women tend to increase that VO2 max with increases in just oxygen extraction alone. So they increase the VO2 max in a similar manner, but not exactly the same. So again, the cardiac output and the oxygen extraction is increased in older men, but in older women, it's simply just the oxygen extraction. Becomes more efficient extracting the oxygen once it gets through the capillaries surrounding the working tissues. Switching gears to muscular strength and endurance, the strength decline starts around age 30, and it starts to really accelerate once we get closer to 50 years of age. And it's about 15% per decade. That's a pretty massive decrease. Once we get to age 70, it starts to get about 30% per decade. So it starts to rapidly decrease. However, if somebody is sedentary, they can still improve their strength as they get older. So intense or greater than 80% 1 repetition maximum shows increase in the mass and the strength of muscle. Now, it's not going to be nearly as much as somebody, again, who is younger, who is 20, 30 years of age, but they're still going to increase some muscle mass and increase their strength. In fact, their strength can actually increase disproportionate to the mass that is being gained. They can't gain nearly as much mass as a younger individual can, but their strength can still increase, but it's just disproportionate to the mass that has been gained. So it's still important for older individuals to strength train. In fact, it could be the most important aspect. It's going to help them stay upright, help them with balance, help them doing daily activities. That's the most important part. Looking at body composition, there's a general increase in body fatness as we age. So the average of 16 to 28% in 25 to 75-year-old males, and comparing 75-year-old females to 25-year-old females, we have 25 versus 41%. So there's close to a doubling of the body fatness as we age from 25 to 75, that 50-year range. And we've gone over some of the reasons potentially why we would increase the subcutaneous tissue in those age ranges. In general, the fat-free mass is somewhat stable until we get to about age 40. Then it starts to do some funky things. It decreases 3% per decade between 40 and 60. And then once we get to around 60 years of age to 80 years of age, it starts to decrease 6% per decade, at least in males, and then a little bit different in the females. But again, as we age, our fat-free mass tends to decrease, our fat mass tends to increase. Bone mineral density. The rate of decline is similar to the loss of the fat-free mass, and in females in particular, this decline is actually accelerated after menopause. Now, being able to maintain bone mineral density is going to be dependent upon the activity levels, weight-bearing exercises that they are performing, calcium intake, and vitamin D intake. Those are the important factors. Probably the biggest factor is the weight-bearing exercises. Those are very, very important for maintaining bone mineral density. And flexibility. The joint range of motion decreases with age as well. This is caused by the increases in collagen cross-linkages in the tendons and the ligaments that become a little bit tighter, a little bit stiffer, and also the articular cartilage degradation that is occurring. This definitely affects, in a negative manner, the activities of daily living. There are a lot of low back issues. Now, it's difficult to separate aging effects from the effect of lack of physical activity because both of them are causing a decrease in flexibility, but which one is causing more? Probably about the same. However, flexibility can be improved with at least 2 days of some static stretching. Now, I've gone into a rant in the past about static stretching not being beneficial, at least for athletes. But for somebody who is getting older, static stretching can actually help. It can increase flexibility. But also strength training, some type of light strength training in these individuals is also going to help. Balance and falls. With the strength training in older adults, and when I talk about strength training in older adults, I'm not talking about powerlifting or anything like that. I'm talking about doing simple workouts where they are using strength bands or light dumbbells. So balance is related to strength, vision, the proprioception, knowing where we are in space and the limbs and where they're located in relationship to one another, any medications that they may be on, illnesses that they have, flexibility, and also some environmental hazards. There's an increased difficulty of balance exercises. So the balance exercises can be improved and help to improve the ability to maintain posture and not fall over by doing a couple different things. Narrowing the base of support. It helps to cause them to contract muscles to keep them upright. Having a wider base of support is more beneficial for balance and stability, but in this case, you narrow the base of support, so it helps to improve those capabilities of those muscles that help keep them upright and balanced. Displacing the center of mass, and also minimize contributions of visual and proprioceptive pathways, closing their eyes, or maybe having headphones on or earmuffs. Some guidelines for older adults, they're the same as for regular adults. So approximately 150 minutes per week of moderate intensity exercise, muscle strengthening activities more than twice a week or 2 days per week, and try to avoid inactivities for a very long period of time. Now, this may differ substantially in health risk, cardiovascular fitness levels or the VO2 max, and also experience with the exercise. If they are previously sedentary, that might affect what they do going forward in the prescription moving forward. Also, special considerations just for older adults. If the 150 minutes of activity isn't possible, recommend that they are as active as possible as their abilities and conditions allow. Also, it's key to understand how chronic conditions can affect the ability to perform regular physical activity. Some conditions, chronic conditions, are going to limit the ability to perform physical activity at all or certain periods of time, in terms of the length of time, certain intensities as well. Cardiorespiratory fitness exercise prescription for older adults. Special attention must be given to progression. So they're going to be progressing a little bit slower than somebody who is younger. So keep that in mind. Looking at a conservative approach for the most deconditioned individuals. Again, they're not going to respond nearly as well as somebody who is younger. So starting off at a really low intensity and really progressing fairly slowly if needed. Looking at the frequency, the total volume can be spread over the course of a week, and even spread out through the day. Small chunks of physical activity throughout the day, over the week. It doesn't have to be all at once. If you can measure the maximal heart rate, that's an important aspect here, so that you can get the proper intensity for the individual. So use a lower end of the target heart rate for those that are new and are deconditioned, and maybe use RPE to determine if the intensity is actually suitable for that individual. And the recommendation here would be the Borg scale, which is that 6 to 20 scale. And again, the time can be split up into 5, 10-minute segments. It doesn't have to be all at once. Muscular strength and endurance. So light intensity, 40 to 50% of one repetition maximum for the first few weeks anyway. Then one or more sets of 10 to 15 repetitions of maybe 8 to 10 exercises. And performing this about 2 times per week. And it should be on non-consecutive days. It doesn't have to be back to back. If arthritis is an issue in certain joints, then the exercises that are going to affect that arthritic joint shouldn't be performed. So again, there could be some limitations in the exercise routine itself, and that could be day to day or week to week, and also year to year as they get older. Okay, that was chapter number 17, exercise in older adults. Hope you had fun with that one. It's going to happen to us someday, so you might as well be aware of it. And I'll see you in a second. Think about how many old people that you know or have known throughout your life. And were they active? Were they active before they got old while they were younger and continued that activity as they got older? What was their lifestyle like? Did they smoke? What was their diet like? All of these things that we do when we're younger is going to affect us as we get older. Now, we didn't go too far into depth of that type of stuff in this chapter, but keep in mind, somebody who is starting off exercise habits when they're really young can continue that, likely continue that throughout their adulthood and even into the older age. And as we've seen from the first chart, the first table that we had there, there is going to be an increase in the amount of older individuals. We're talking 65 years of age or older as we go on through the decades here, up to about 90 million or so within the next 30 or 40 years. Now, this could start to have implications on the economy through the healthcare system most often. And as we get older and have more and more older individuals, a lot of times they're retiring at about the same age because we haven't changed the time to retire in like dang near 100 years now, even though we're living a little bit longer. Whoops, political statement. So the implications of that, even though they are not working, they may have some help with medical costs and all that stuff. But there is going to be a greater and greater cost as we get older and older, unless there's some type of magnificent breakthrough that we have, you know, we can reverse the aging process, within the next, 20 or 30 years. But older people just have diseases. That's just the way we are. That's the way nature works. It's part of life. It sucks, but that's just what's going to happen. So anyway, having them exercise, even if they've never exercised a day in their life, if they're going to exercise, start exercising when they're older, still a good thing to happen. Really focusing on not just the cardiorespiratory stuff. That's beneficial if they can do it. But really, we've seen that the strength training, and again, I'm not talking about powerlifting or anything like that. You don't want grandma doing a deadlift or a power clean. Now, if she can do it, that's great. But she doesn't necessarily need to do that. Just getting some soup cans and performing some type of curls and using elastic bands, the TheraBands, all that stuff, doing stuff like that. That's really going to be more beneficial than telling them to go for a jog if they can jog. Now they can go for walks and stuff like that, or, older people walking in the mall, if you've ever seen them do that, which is good now because malls are basically dying. So that's, what else are we going to do with these buildings? I digress. Strength training is going to be the most beneficial for them. That helps keep the muscle mass there. And now it's still going to degrade over time, especially once we get into 70s and 80 years of age. It's going to start to decrease quite a bit. Metabolism starts to decrease. You get hormonal releases that are changing as well. And we're decreasing muscle mass as we get older and older into really old age. But slowing that down at least a little bit, maintaining some of the strength, is going to help them keep their balance, keep them upright, and also help for daily activities, so where they can have some autonomy while they are at home. And they can play with the grandkids, they can walk up and down the stairs, they can go get groceries and carry the bags themselves. So there's a psychological aspect to it as well. They still feel like they can do some of the things that they could do when they were younger. They might not be able to do them as well, but they're still able to do them. So psychologically, it's beneficial for them also. So strength training, important aspect of it. Now for the testing aspect of it, multiple repetition maximum for any type of strength training, and also for cardiorespiratory fitness training. You don't necessarily need to have them do a full-on max test. Definitely not necessary. So performing a submaximal test to try to get an idea of what their maximal aerobic capacity is. And there's different tests that you can actually perform for this. And we actually went over them, a couple of them, before the chair, sit, and stand test. You can also do the get up and go test and things like that to see how quick they are. And that's more of like an anaerobic, but there's different versions of it that are a little bit longer. There's a different walk test to estimate VO2 in older individuals as well. So, but we're not going to go into all of that stuff. So just looking at the aspects of older individuals, the type of training, the adaptations that they have, and also what is most beneficial for them, and maintaining, or at least slowing the regression of muscle mass. That's going to be beneficial. So that was chapter number 17, exercise in older adults. If you have any questions, don't hesitate to ask. So, all right, let's turn the flux capacitors back on, and let's come back to 2020 and get back to our younger selves. Ready? Okay, I'm here. Oh, whoops, I went a little bit too far. Okay, now I'm back. Okay, good. All right, if you have any questions, let me know. Thanks for watching.